Hi everyone, another installment today of my videos. Today I'm going to be talking about my favourite topic, which is poo. Now everyone does it and we all need to just normalise the discussion around it. It is super important for everyone, but really important after surgery. Obviously, when you've got all of those wounds internally, we don't want you straining. We're going to have given you medication to ease the pain, no fibre, lack of fluid initially when you are initially post-op. And so it is a bit tricky to start off with to normalise your bowel habits. Now, some surgeons will recommend a laxative for their patients while they're in hospital and when they're discharged. Certainly, the medical team that I work with do use that. So please take what you are prescribed to take. Don't worry about it. If you have any concerns, then talk to your surgeon and I'm sure they'd be happy to answer any questions that you have. One of the things that I put in my kitty for my patients is a fibre supplement. Now this particular one, I'm not endorsing it, but the one that I normally recommend is Fibre. This can be picked up from chemists and supermarkets. The reason I recommend this particular supplement is because when you mix it into liquids, it doesn't thicken and gel. If you put something like Metamucil into a glass of water and you mix it, over time it thickens and gels and actually absorbs all of the water, and we really don't want that happening in your nice small stomach. So Fibre will just stay mixed in and nice and clear, and it is taste-free. I do have some people who say they can taste it, so just use small portions of it. Now, I'll leave it up to your dietitian to tell you how much of it you should be taking, and you can get this, as I said, really easily, and I would buy it pre-operatively. Now, I recommend that my patients start this when they're tolerating over a litre of fluid a day. If you start it earlier, it can actually bind you up. So taking it once you're drinking enough fluid. Now, this is not a laxative. They actually work really nicely in conjunction with laxatives. So I know the laxative that we recommend and use in hospital is a laxative that pulls water into the bowel, and then this fibre supplement is meant to then hold on to the water and hold it in the bowel motion so that you can be passing a nice soft bowel motion. If you have a day where you don't manage your hydration nicely for whatever reason, that would be the day that you drop off the fibre and then focus on your hydration, get it back up, and then start your fibre again. Now, this is my very favourite chart that I use all the time. It's called the Bristol Stool Chart, and if you Google it, you can find many images of it. Now, it is really helpful when you're talking to your dietitian that you talk to them about what type of bowel motion you are passing, because everyone's normal is very different, and what we're after is this type 4 bowel motion here, which is like a soft sausage. If we start to go up to this rabbity poo at the top here, this is too hard and we need to act really promptly to get that to soften down. If your surgeon has prescribed a laxative, then take your laxative. If they haven't, then you might want to call the surgeon's rooms and just flag to them that you've been passing really hard bowel motions and what you should do about that. We also don't want a type 7 down here, which is just pure liquid. That's not pleasant for anyone. It's not too bad if you end up with a type 5, which is what can happen if you are taking a laxative. It's just sort of soft, fluffy mush. But type 4 is what we're after. And if you actually have a picture of this in your bathroom, it is actually helpful to, when you talk to your dietitian, to say it's a type 4 bowel motion, and they will be super impressed that you know what that is. All right, hopefully that's helpful. Any questions, just pop them below. Bye.